This is just kind of a fun one to put on your radar because we don't have a lecture about this today, but when you're looking at you know, first trimester pregnancies, I want you to have at least an example of it. So clinically, this uterus is enlarged, and we have a positive pregnancy test. And this is a sweep. We even have this labeled, the right side of the mom of the uterus and the left side of the uterus, and we are transverse. So my indicator's towards the mother's right side, and I am scanning from the cervix, and now we are to the fundus, 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 all the way through the fundus that way. Okay, so now we're at cervix, all the way through fundus. I heard someone say, I think I see a pregnancy. Over here? Yeah, way over here. Okay. So if I was to kind of freeze the image, I wonder if I can do that. Can we do that? You're going to see the answer then. So if I was to freeze at the very beginning of this slide, right here, do you see there's actually two separate, right here and here, these two little separate endometrium, and then they continue to split into two separate endometrium. So all the way at the beginning of the cervix, all the way down here, there's two endometrium. There's two endometrial canals the entire length of the cine loop. So even just given that information, without getting into like the categories of things here, what are we thinking? Some uterine anomaly, right? There's some uterine anomaly. And based on this, because there is two cervices the entire length, right, it's probably got to be a bicornuate bicallus, which implies that you've got two cervices and two horns. As you're getting up towards the top of the cine loop, you can actually see, and again, transverse, if you think about it, what's happening is those horns are splitting, and so my image at the very top of the fundus, I almost have two separate, right here and right here, like two separate horns. So we have an IUP where? In the right horn. Okay, so what's our overall diagnosis? Yep, we've got a pregnancy and a uterine anomaly. Before I show you the answer, this is like super extra credit. What if I told you, because this is actually true, that this patient also had two vaginal canals? So we have two vaginal canals, we have two cervices, and we have two separate uterine horns. Do you know what uterine anomaly that would be? Not super common. Actually doesn't have a huge increased risk for poor fetal outcomes, interestingly. Didelphys uterus. So I think everybody kind of jumps to this bicornuate. You really have to have vaginal septum to make that diagnosis, but it's two of everything, okay?